Hi everyone, and welcome to Nurses Notes 101. I'm Alexa, and this is part 2 of the cardiac RN question review. So I'm going to go over 20 plus patient scenario questions. I think this is the best way to study. When I was back in school, this was the easiest way to really retain information, because when you go over specific patient scenarios, I think it really helps because it puts it in real time. So here we go. This is a continuation of part 1, just as a reminder. So part 1 I posted last week. If you would like to take a look at more cardiac questions, go back to there. The questions were, there was a lot of questions on like left ventricular failure, medications, medication side effects, electrolyte abnormalities and how they would manifest. So those were really good questions as well. I'm going to start at question 12 here because I ended at question 11 on that one. And the way that this works, I'm going to go through each question, read the question, kind of zero in on what you guys should look for in the question by picking apart what words in the question are important, looking at all 4 answers, and then I'm going to ask you guys to pause the slide so you have a chance to think about it. I think for each question, you should give yourself a minute, no more, just because you want to make sure that you are timely still with your understanding of these questions. You don't want to take too long and then have to rush the rest of your exam. So I would give yourself just a minute, pause the content there, and then when you're ready to answer, you can move on to the next slide. Okay, so here's the first one. Question 12. A client with angina complains that the anginal pain is prolonged and severe without precipitating factors. Which of the answers is a description of this type of pain? Okay, so this question is saying that the patient has this kind of chest pain. The key words here are prolonged and severe, and there's no, so it says without precipitating factors. So that's a key thing that we want to look at. There's 4 options here. So option 1, stable angina. Option B, variant angina. Option C, unstable angina. Or option D, non-anginal pain. I'm going to give you guys a hint. Since we're talking about angina, option D does not seem like a correct answer because it is anginal pain. It's not anginal pain, so we can mark option D off the list. So at this point, give yourself a minute. Give yourself that full time to think about which one makes the most sense when we're thinking about chest pain that is prolonged, severe, and comes on without a warning. There's no precipitating factors. Okay, so I'm going to move to the next slide now. The answer is variant angina. So with this specific type of angina, there is no precipitating factors. This question was sort of a terminology question, so even though it was related to a patient, it was showing us that you have the understanding of different types of angina. Good job. Question 13. The nurse is developing a plan of care for a client with a skin breakdown from an infection at the site of enlarged leg veins. What is priority? So the question's asking, which is a priority intervention? So that doesn't mean that in the answers there are not more than one answer that can be an intervention, but we're looking at what is asked, so we're asking for the priority here. So we have 4 options. Option A, keep legs above the level of the heart. Option B, provide antibiotics for leg infection. Option C, cleanse skin with chlorhexidine. Or option D, reposition the patient every 2 hours. So think of what you know about priorities. This also comes as a reminder to think about your ABCs. So airway, breathing, circulation. Think about what's most important and think about, in particular, where this infection is. So that is an important fact in this question. So it's saying that there's an infection at the site of enlarged leg veins. So we want to note that, and we want to think about what the possibility of that infection, of the infectious source, what the possibility of that could be, and see if that would kind of help us figure out the priority of what this patient needs. All right, so pause the question here, give yourself that minute to think about it, and I'm going to move to the next slide. The answer for this question is A. So keep legs above the level of the heart. So if you guys figured out that the enlarged leg veins are varicose veins, then you are correct. With someone who has peripheral vascular disease, the best way to treat this and relieve that pressure is to keep the legs above the level of the heart. While the other answers could be correct, so providing antibiotics to an infection is definitely important. Repositioning the patient every 2 hours could be important too, because it seems like at this point they're not as mobile. And option C, I don't know if that'll actually happen, because even though we should be cleaning the wound, I don't think chlorhexidine would be the best option because it would probably burn the patient. I would probably think that the physician would order more along the lines of a saline washout and maybe just a dressing cover. But that's why we have to be clear what the question is asking. So it's asking priority. Priority is to promote circulation of the site, which is our ABCs, so that's option A. Good job. Question 14. Patient scenario. The nurse is caring for a client with a cardiac history. The patient is on a monitor, and the nurse notes that the client has developed atrial fibrillation at 128 beats a minute, so uncontrolled AFib. The nurse's priority assessment of this patient is 4 options here. A blood pressure of 90/54, jugular vein distension, C, complaints of stomach pain, or D, hyperthermia. So kind of think of this patient in your mind. We have someone, they're in uncontrolled AFib because the rate is over 100. So their heart is quivering at a beat of 128 per minute. We're looking at all these options of what the patient is presenting, but what is the patient's priority? Think back to what I said before. Airway, breathing, circulation. Which of these 4 options, if they are true, would be something that would be most concerning, our priority? Pause the slide here, give yourself that minute to think of the answer, and then move on to the next. I'm going to move on now. The answer is A. So with a 90/54 blood pressure, we can see that the patient is becoming hemodynamically unstable. So due to a lack of adequate cardiac perfusion secondary to uncontrolled AFib, because their heart is quivering so fast, that is causing low perfusion and low blood pressure, which is affecting the patient's, potentially affecting their mentation, affecting obviously their vital signs here, but it can also be outwardly affecting them too. They can be diaphoretic, feel anxious. That is priority. While this patient could potentially have B, JVD, that's not priority. While they could also have an infection or a fever, D, not priority, and complaints of a stomach pain is not priority when the patient is hemodynamically unstable. Question 15. The nurse is performing an assessment on a client with angina pectoris who takes nitro at home. The client's currently complaining of chest pain and a headache. What questions should the nurse then ask? So we have 4 options here, like usual. Option A, how severe is the pain? B, are you lightheaded? C, do you need sleep medication? Or D, did you take your nitroglycerin? So this is a priority question without actually stating it's a priority question. So one of the things we are aware about with this particular person is that they take nitroglycerin at home. So that is known. what's most important when this person comes in with chest pain still, we want to know if they have taken their medication today, if the pain has helped it, if the pain has resolved at all, if they did take it, and then if they did take it, if they're having any side effects from it. So keep that in mind. Give yourself a minute, think about what the answer could be, and I'm going to have the answer in the next slide. Answer for question 15 is D. Did you take your nitroglycerin today? So I did kind of give that away. While some of the other questions are important to ask, this would be the most important because we want to know, let's say the patient took more than one dose. What if they took 2 or 3? If they're going into the hospital and you don't ask that and you give them another one, it could cause, one, a ton of side effects, so they can be hypotensive, drop their blood pressure all the way down. They could get lightheaded, they could pass out, so that's a big deal. The second priority option I would say in this question would be how severe is the pain? Because if they took nitro, or let's say if we gave them morphine when they came in and they're still having 10 out of 10 pain, that could mean that this angina pectoris could be evolving into something else, an aortic dissection. It could be something that's missed. So if the pain is still severe to that extent, it could warrant a scan, like a CTPA. But in this question, because it doesn't appear that they have been asked if the nitro was taken today, that is definitely priority when asking the patient about their history and when they come in with a known knowledge of taking nitroglycerin. Good job. Question 16. A client has experienced a heart attack. The nurse knows that the person's current chest pain is caused by tissue hypoxia in this heart layer. So this is more of a terminology question. So the question is asking, which heart layer does tissue hypoxia occur in? So we have 4 options here. Option A, myocardium. Option B, pleural parietal. Option C, parietal pericardium. Or option D, pleural visceral. I want you guys to think about what pleural means. I want you to think about what parietal means. I want you to think about what visceral means and what pericardium means, and cardium as an end, as a suffix. Think about what that means, cardium versus pleural, and hopefully that'll help you knock down a few answers. Okay, pause the slide here, give yourself some time and think about what the correct answer would be. The correct answer is, for question 16, myocardium. So myo as a prefix means muscle, cardium means heart. So whenever you see cardium, think heart. And like I said before, think about what pleural means. Pleural means lungs. So option B and D you can nick off right off the bat because we're talking about the heart and a heart attack. So the lungs are not involved here. So it would either be option A or C. The parietal pericardium has to deal with the fluid sac that encompasses the heart. So it would either be that option or the muscle of the heart. You would have to think hypoxia is coming from where the heart's activity is coming from, which is from the muscle layer. So it's option A. Great job. Question 17. The nurse is watching the cardiac monitor of a patient. There are no P waves on the monitor, but a clear QRS is noted. The nurse interprets that the client is experiencing which rhythm? We have 4 options here. Rhythm choices are A, sinus tach, B, ventricular tachycardia, C, asystole, or D, junctional rhythm. So this question is really asking if we know the difference between each rhythm strip. Do we know what asystole looks like in comparison to the 3 others, and vice versa? And also noted here that there is no P wave, but there is a clear QRS. This question does not depict how the QRS is represented, but it says it's clear. Take a minute, think about which is the best answer for this question. Answer we have here is D, junctional. So hopefully you guys were aware that a junctional rhythm either has no P waves or inverted P waves, but the QRS is actually normal. So the QRS isn't wide, it isn't too narrow, it's within normal limits, and it's usually normal in a junctional rhythm. For asystole, there is no QRS and no P wave, it's pretty much a straight line. For ventricular tachycardia, the QRS is wide and bizarre. And in sinus tachycardia, there are P waves. So the only logical answer for this would be D. Good job. Question 18. The nurse is assisting in the care of a client who is pending cardioversion. The nurse plans to set the defibrillator to which starting energy range level per provider? So this question is asking if we know how much joules the patients get when they are cardioverted. So we have four options here: 25 to 75, 50 to 60, 300 to 450, or 100 to 150. Take a minute here, think about the best range that you've learned in the past for cardioversion. Answer for question 18 is 100 to 150 joules. Anything below 100 joules is not enough energy, and anything above 150 is excessive for cardioversion. However, for defibrillation, you do utilize more joules. For defibrillation, with a biphasic defibrillator, you start with 150 joules, and then for all the recurrent defibrillations, if needed, it's 300 joules. Question 19. A client is diagnosed with pericarditis. The nurse should assess the client for which manifestation that differentiates pericarditis. Four options here. So this question is really asking if we know what pericarditis looks like, the signs and symptoms. So A, posterior pleural pain. B, pericardial friction rub. C, hemoptysis. Or D, chest pain that worsens on expiration. So think about what you know about pericarditis. Give yourself a minute to answer. Figure out what signs and symptoms would most likely be manifesting, and then the answer is coming up. The answer to this question is B, pericardial friction rub. If you guys weren't aware of what option C is, hemoptysis is coughing up blood. D, the option for chest pain that worsens on expiration, is not like a key sign with pericarditis. It could happen, but I think what's usually seen in pericarditis is actually worsening chest pain and inspiration. Pericardial friction rub happens in these patients due to the inflammation of the pericardium, so it causes this leathery sound that we can hear when we auscultate. Question 20. The healthcare provider prescribes bed rest for a client who is admitted for a DVT. What intervention should the nurse plan to include in the patient's plan of care? So the last two questions are select all that apply. So I want you to look at all four options and select any of the four, any and all of the four that the nurse would expect to have in a plan of care for a patient with a DVT. So let's see. Option A, place in semi-recumbent position for eating. B, encourage incentive spirometer use. C, encourage high caloric intake. Or D, place sequential TED device on patient's leg without the DVT. Take a minute here, think about the best options for this answer, and remember that it is select all that apply. The answer here is B, encourage incentive spirometer use, or D, place sequential TED device on patient on their leg without the DVT. Sorry, typo there. The other two, so semi-recumbent position, like I've said in previous discussions, is a position used when giving a patient a suppository. It's not a position you're going to put someone in for eating, so that's completely false, that option. And then a high caloric intake isn't necessary for a patient with a DVT. What would probably be better for them is eating small meals frequently, not like a high caloric intake all at once. D is appropriate because we do want to provide DVT prophylaxis, but not on that leg because they do have a DVT on one side. You don't want to put a sequential TED on that leg because they're at risk of it breaking off and going to the heart or the brain. So we can put it on an alternating side. And incentive spirometry is always good, especially if someone is bed rest. Most patients who get DVTs are bed rest, so this will help with lung expansion and preventing atelectasis, things like that. Last question. Question 21. A nurse is conducting a health history of a client who is diagnosed with heart failure. Which condition is not a risk of heart failure? So that's all that apply. So again, this question is a negative, so it's asking what is not a risk of heart failure. We have 4 options here, but we can have more than one right answer. So A, emotional trauma, B, emboli in the right atrium, C, ability to sleep well, or D, risk of obesity. Give yourself that minute here to think of the best answer that you have. And remember, it's selected all that applies, so it can be multiple answers. The answers to this question are A, emotional trauma, and C, ability to sleep well. So this is stating then that both A and C are not risk factors of heart failure. But as you can see, these answers can be side effects of heart failure, but they're not predisposing you to heart failure. On the other end, risk of obesity and an emboli in the right atrium is a risk of heart failure. But these other two, A and C, are not risks of heart failure. Okay, that's it. Thank you for listening to Nurses Notes 101. Please like and subscribe to my channel. I hope this helped you. And I think in your next cardiac exam, this will be very beneficial for you to watch again. Go over these questions just to kind of get a refresher. Patient scenario, like I said before, always seem to be the most beneficial questions for me. So I hope this helps you too.